it's Sam from babyREADY. And this episode, I'd like to spend a little bit of time talking about what the signs and symptoms are of labor. Your body goes through so many changes through the latter parts of pregnancy, and it can truly be difficult to know whether what you are feeling at this time is actually a clear indication that your body is getting ready for the labor process to begin, or whether or not your body is just being pregnant and keeping the baby healthy and well and moving and everything else. So it is important to know that as a first-time parent, you are likely going to gestate longer than you would if this was your second or subsequent child. It's changing in the world how care providers are willing to allow expectant parents to progress through their pregnancies. More and more often these days, I am seeing care providers choosing to artificially start the labor process before 40 weeks. But typically speaking, and if you're allowed to do what your body is prepared and intending to do, you will likely gestate with your first child for between 41 and 42 weeks. The Society of Obstetricians and Gynecologists of Canada dictates the rules for all care providers who catch babies, whether you are having your baby with an obstetrician, whether it's with a midwife, or whether it's with your family doctor. The SOGC, or the Society of Obstetricians and Gynecologists of Canada, say that all babies must be delivered of the birthing parent by the time they are 42 weeks completed gestation. The reason for that is because the placenta stops functioning as optimally or slowly decreases. The reason for that is because the placenta slowly decreases its efficacy in function once you're past the 40-week gestation period. That doesn't happen rapidly, and it doesn't happen consistently with all expectant parents and their pregnancies. The challenge is that it's impossible to look at one expectant parent and say you are going to have an issue and someone else is not. So because they don't have this capability to see beforehand, that is why the rule is put in place. But as I say, all things being equal, being allowed to go into labor on your own when your body's ready, typically for a first-time parent, this will happen between 41 and 42 weeks gestation. That isn't the case for everyone, and I recognize you may have a family history of rapid labors or early labors or any of those kinds of things, and that all happens, absolutely. But this is just a general guideline. So between 41 and 42 weeks gestation, you will likely find that your body's giving you indications that it's ready for labor to begin. And then from there, some of the indicators may be things like losing your mucus plug. Now, I have had many expectant parents or early laboring parents reach out to me and say, I lost my mucus plug. That's exciting. Perfect. The mucus plug is a glob, for lack of a better word, of mucus that sits inside the cervix throughout the pregnancy. And it functions to protect the baby from anything getting into baby's environment that could potentially harm the baby. So as the cervix begins to change throughout the latter part of pregnancy for some people, or in early labor for other people, what can happen is that the cervix will slowly start to release the mucus plug that's there. And for some people, it is truly a glob of mucus that comes out. I tend not to focus so much on that for two reasons. One, the mucus will continue to replace itself until the baby is born. And so if you lose a glob of mucus, it doesn't mean all the mucus is out. It will continue to be there and be present as the labor progresses. But more than that, I want to know what color it is, because if it is clear, then that may be mucus that you're losing, but it's not indicating to me that any real signs of change are happening within the cervix. We want the cervix to change to a point that capillaries in the cervix are popping as it's changing. And the viscosity of the blood is so different from mucus that it takes a small amount of blood to stain a large amount of mucus red. And so we want there to be more of a bloody show. And that bloody show tells me something's going on in the body. Next, then I want to know what color that bloody show is. Does it look like the end of a menstrual cycle? Is it a bit brownish in color? Then that tells me that something did happen. Perhaps it's a result of a stretch and sweep, which we'll get to in another episode. Or some cervical changes happened, but that was a little while ago, and now your body's starting to think about things happening again, and so we kind of will move from there. So if it's older blood, that's still an indication that something's happening, but it's not telling me things are happening now. If it is more pink or bright red, like fresh blood is, then that tells me that something has happened really recently. Again, it may have happened right after a stretch and sweep, but this may be when you get up to go to the bathroom in the morning, and as you wipe, you notice there's a pink or red tinge on the tissue with the mucus there as well. As long as that's fresh blood, that's telling me something has recently happened with the cervix. Perfect. Now I want to know, is it happening every time you're going to the washroom? Because if it is, then that's an indicator that maybe your body is getting ready for the labor process to start. And that's exactly what we're looking for. So I would tell somebody to continue to keep me apprised of what they're seeing, what they're feeling, and that overall they're feeling well. So that's the bloody show or the mucus plug. Some people reach out to me and let me know that they are feeling a sense of restlessness, a sense of unease, unable to sit still. Sometimes I am of the opinion that this is baby's way of saying that they're not quite perfectly placed within the pelvis, and they need you to spend some time in a variety of different positions to get their head better applied to the cervix so that cervical changes can take place and get the labor started. So in the days leading up to labor, you may find that you really can't get yourself comfortable. So instead, you're spending time on your hands and knees on the sofa while you're watching a movie. That's a great position. Spending time on an exercise ball, rolling your hips from side to side versus front and back. And that rolling side to side will actually help to move the pelvis and the baby within the structure of the pelvis. Climbing stairs can help, those types of things. So give them a shot if you're feeling a sense of restlessness and see whether or not that works for you. That is just that, some people call that the nesting phase. I wouldn't necessarily call it nesting, but it's certainly in that category. I want to also let you know that it is my plan to bring in or ask a friend of mine who is a spinning babies professional to talk with me on one of these posts at some point about ways to make sure that your baby is optimally positioned within the pelvis in preparation for birth. So I will reach out to her and have her spend some time talking to you about that. And that sort of is related to the nesting, or what people call the nesting phase of labor preparation. So another sign. So we've talked about mucus plug or bloody show. We've talked about nesting or a sense of restlessness. Another big one is loose bowels. And it's funny, when I'm teaching a prenatal class, often one of the concerns that I hear from expectant parents is the worry about delivering more than just the baby on the table. And quite honestly, when left to go into labor on your own, it is typically found that your body will evacuate itself or clear itself out in advance. And part of that is really because if you look at the structure of a pelvis and you look at the size of a baby's head and the fact that there's a rectal passage that moves through there as well, it just makes good biologic sense that given the opportunity, your body would clear itself out really for no other reason than to make more space for baby. It does, again, from a biology perspective versus a medical perspective, make good sense that our body would clean itself out before baby arrives, because it doesn't want baby to be exposed to anything that could potentially harm the baby. And our fecal waste is where we expel bacteria and viruses and things like that. So all of it left together really just makes good biologic sense that our body would clean itself out. When someone is induced artificially, had their labor stimulated artificially, then our body doesn't get the same cues, and it is much less likely that your body will evacuate itself, although it's not impossible. And so if going into labor on your own, it is highly probable you won't defecate on the table. That said, I assure you, it is absolutely going to feel as though you're having a bowel movement when you're birthing your child, because the baby's head, being the size that it is and how solid it is, presses on all the same nerve endings that fecal waste presses on when it stimulates your body to know that it's time to go to the washroom. So it can be alarming for many people to feel that sensation, and it's understandable why there's a worry. And so many birthing parents believe that the rest of us who work within the community are lying to them when we say you haven't defecated on the table, when in truth they often don't defecate on the table. But you didn't see it, so it's hard to know. So labor stools often happen very frequently and very loosely for 24 to 48 hours before labor really kicks in. And then once you're in labor, you may, in the early phases of labor, evacuate your bowels another time or two to really make sure that the system is cleared out. But once you get into good active labor, you're not going to necessarily need to have a bowel movement again. And in fact, virtually anything you take in is kind of left in your stomach until after the baby's born, when digestion can resume, because your body is so busy processing the labor that it needs to go through that it's not taking the time to process the food that you've consumed. We will also, in another episode, spend time talking about eating during labor, because that is something that lots of people have arguments about. So we will spend some time talking about that. But I want to get back to the topic at hand. We're talking about signs and symptoms of labor. We've talked about the mucus plug or bloody show. We've talked about restlessness or nesting. We've talked about labor stools. It's all sounding really great so far, I would say. We're going to talk about water breaking next. And if you watch TV or you watch movies, then you would assume that virtually every person who's about to go into labor is going to have that be their first indicator that something's getting started. And most definitely their water is going to break with a big splash in an extremely embarrassing location. Less than 10% of people have their water break as an early indicator that labor is starting. So that changes the thinking for a lot of people. If that's the sign you're looking for, now what do I look for? Well, you look for some of the other things we've already discussed and what's coming up. Your water may break one of two different ways. It may break as a slow break or a hind leak, where it feels like you are continuously trickling fluid. And if that is the case, then you will know this best by feeling like you're peeing without being able to control yourself. You're putting on a pad, the pad is getting wet, it's clear fluid, but it's not stopping. And it certainly hasn't been a big gush. So a lot of people feel like, is this truly it? I've lost all control of my bodily functions. I am now urinating without having any control over it, when in fact it may be a hind leak. It is something that is more common if you've tested positive for group B streptococcal virus. So the GBS swab that they do at 36 weeks does indicate that that might be something you are more likely to see, but it isn't exclusive to the GBS positive group at all. But it is still something of note. And if you have had to change your pad frequently and you think that your water might have broken in this fashion, it's worth it to reach out to your care provider to find out what their next best steps are. It is easier when your water breaks as a big gush. Sometimes some people feel it pop, but you find that there's a considerable amount of fluid that comes out all at once. It's more likely to happen rolling over in bed, getting up off the toilet, climbing a set of stairs, getting out of the car at the grocery store versus while you're in the grocery store reaching for bananas, that kind of thing. So if your water breaks as a big gush, then the best thing that you can do, regardless of how your water breaks, is to determine what the color of it is and is there any smell to it. Your care provider is going to want to know what the color of it is because it can be an indicator that there's been meconium that's passed into the amniotic fluid. When we talk about induction and things like that, we will spend some time talking about meconium. Meconium is the fecal waste that's in the baby's gastrointestinal tract, and it's there for throughout the pregnancy and will be evacuated over the first 72 hours or so after the baby is born. So if there's meconium, we just want to be able to document that and monitor how the labor is unfolding. If there is a funny smell to it, sometimes it can be an indicator that there's some kind of a yeast infection going on, and sometimes some people believe that their water has broken when in fact it has just simply been an excess amount of discharge as a result of a yeast infection or a bladder infection. So those kinds of things are worth noting and telling your care provider. And then when you speak to them about the fact that your water broke, they will have the opportunity to tell you what they think is the best approach for your labor moving forward. So truthfully, the next sign that things are getting started, more than anything, is contractions. And above all else, contractions are what we spend our time paying attention to. But how do you know whether or not the contractions that you're feeling are in fact real contractions or false contractions, or real labor or false labor? And I have to say I hate the term false labor, because false labor is going to feel pretty real to you until you get really into the swing of labor. But when we say false, it's just one of the many times that we use negative expressions to describe to someone what is happening with their body. It's not false labor, it's just early or pre-labor. It's your body's way of getting the process started without jumping in with 2 feet, so that you have the opportunity to adapt. The best gift you can give yourself is that if you think you're in labor, try to make it stop. That sounds counterintuitive. You've waited weeks and weeks and weeks to meet this person, and now all of a sudden your body's finally giving you an indication that perhaps this child is going to evacuate your body, and now you're being told to try and keep it in. And that's not what I mean at all. But what I can tell you is that if this is truly labor, if this is meant to move forward and give you a baby at the very end of this immediate process that's happening right now, then there's nothing we can do to stop it. That's what I mean. There's nothing we can do to stop it. We wouldn't have babies born at 28 weeks gestation if there was a way for us to stop the process, truthfully stop the process, once it's actually started. So the only thing that might happen if you try to get your labor to stop when it's still early in the process is that you might get some extra rest. And I promise you, you will be glad to have that time and that energy back when you're at the active labor parts or transition or pushing. So rest as much as you can. How do I try and get labor to stop? You rest, you hydrate. Hydrate's really important. Lots and lots of clear fluids. Maybe have a bath. Let yourself soak in some warm water, but lie down, close your eyes, put on some music in the background. Just let yourself calm, cleanse, and relax. And if this is really the process moving forward, you might catch a few minutes of sleep, and you may find that things just jump forward a little bit. We're looking to time our contractions from the beginning of one to the beginning of the next. And in early labor, it's often that they're 20 minutes apart and only lasting about 20 seconds. Then you get a 19 and a half or so minute break between, and there's no residual discomfort between contractions. So even if this is really it, and you're trying to get it to stop, you're probably going to rest for about 19 minutes out of every 20. And it's easy to pass a few hours with only a few minutes worth of contractions. So give yourself that gift Labor's hard work. We don't call it labor for no reason. It is hard work. You're going to want that energy conserved as best you can. And I recognize you're going to be super excited that the process has started. So give yourself an hour or so before you try to rest, but do give your body also the gift of rest. I think that's a lot to cover for one episode. As you know, I'm still fairly new to this, so I'm going to leave it there with signs and symptoms of labor. We will regroup next time and recover these, and then we'll start talking about how labor typically unfolds. I hope you have a great day, and I will talk to you soon. Thanks.